These are in no specific order. Viruses. They are cultured in labs. There are very few effective therapies. Medication error, category 2. Yes, there was an error. The error reached the patient. The patient was harmed. There was an intervention to sustain life, but there was no permanent harm. Medication error, category 1. There was an error. The error reached the patient, and it resulted in the patient's death. A medication error is any preventable event that may cause or lead to inappropriate medical use or patient harm while medicine is in the control of healthcare professional, patient, or consumer. Gender influences on pharmacotherapy. Women seek healthcare sooner than men, except for when it comes to heart attack or heart disease. And the majority of drug research studies were conducted mainly on white men. A blank is a substance, organism, or physical agent to which an embryo or fetus is exposed that produces permanent disability or death, and that's a teratogen. Herbal therapies, there's no woody substances or bark. It's the whole plant with dozens of active chemicals, and they are considered drugs. Complementary and alternative medicine, or CAM. It focuses on self-care and self-healing. There's like a role of spirituality. Treat each person as an individual, and it is outside of Western meds. Some forms are naturopathy, herbal therapies, massage, yoga, faith and prayer, detox. The regulation of herbal and dietary supplements. The DSHEA of 94, you must state that it's not intended to diagnose, treat, or cure disease. And it changed in 2007 to where the ingredients need to be listed as well as the adverse effects. Toxic chemicals. There's the nerve agents, and those are cured with atropine. Blood agents do not induce vomiting. Encourage them to drink milk or water. The choking and vomiting, rinse the nose and throat with saline and the skin with borated talcum powder. And the blistering, do not induce vomiting, and you can use a 5% household bleach solution and encourage them to drink milk. The blank is a systematic method of problem solving that forms the foundation of nursing practice, and that's nursing process. RCA, or root cause analysis. You want to ask what happened, why did it happen, and what can be done to prevent it from happening again. Weeks 1 to 2 of the first trimester are known as the pre-implantation period. Pregnancy drug categories, you have A through D, and then you have X. X you do not use. That would be like testosterone and warfarin. D is a risk as well, but X is the do not use category. When should a breastfeeding woman's drugs be administered? And that's immediately after breastfeeding. Pharmacotherapy for infants. Your primary goal is for the infant to ingest the entire dose. Hold and cuddle the infant. Put the oral meds in the inner cheek and allow time for the infant to swallow. And also for the IV, you might need to use feet or scalp veins. It may be more easily accessible. And then when it comes to rectal suppositories, hold the buttocks together for 5 to 10 minutes. Pharmacotherapy of toddlers. Safety is your number one priority. Give short, concrete explanations and then administer. And avoid mixing the medicine with milk or juice so you can avoid food aversions. Your 5 rights of medication administration is the right patient, right dose, right time, right medication, and right route. Okay. Pharmacogenetics is the study of genetic variations that give rise to differences in drug response. Psychosocial variables in pharmacotherapy, the social and psychological environment. Positive attitudes and high expectations may influence success of pharmacotherapy. Pharmacotherapy of preschoolers and school-age children. There's usually easier cooperation, and the toddler principles are the same for the preschoolers. Briefly explain and praise afterwards. Pharmacotherapy of adolescents. At this age, they like to have the sense of independence, and that can lead to self-medicating. Allow them as much privacy as they can possibly have. Make sure that you're looking up your state laws beforehand. Carefully explain the expected side effects. Even if your patient claims to understand at this age, they most likely do not. The pharmacotherapy of young and middle-aged adults, your goal is to maintain healthy habits and lifestyle. At middle age is when they begin to experience cardio-related diseases, hypertension, and obesity. Pharmacotherapy of older adults, maintain dignity and independence and monitor the liver and encourage using the same pharmacy for all medications. Genetic influences on pharmacotherapy would be the alterations in DNA and how one's body metabolizes drugs. Polypharmacy is taking multiple drugs at one time, and it dramatically increases the risk for drug interactions and side effects. Ionizing radiation, your symptoms are going to be nausea, vomiting, and diarrhea, and you're at a high risk for leukemia. And potassium iodine is used to treat nuclear radiation exposure, but all it does is protects the thyroid. Management of poisonings. Be familiar with your basic elements of toxicity treatment and know basic supportive care, your ABCs, airway, breathing, and circulation. Maintain proper blood glucose levels and arterial blood gases are stable. Safety of herbal products. Natural does not always mean better. Be educated on herb-drug interactions. And herbs lack scientific study. Anthrax. It affects domestic and wild animals. Symptoms appear within 1 to 6 days of exposure. It is spore-forming when it comes in contact with open wounds. It creates skin lesions that turn black, which is cutaneous anthrax, and it is treated with Cipro. Specialty supplements are anything that's non-herbal, like fish oils, vitamin C, CoQ10. They're generally not needed, and they can give patients a sense of false hope. Blank is the data that includes what the patient says, and that's subjective data. Blank is the assessment of goals and outcomes. That's evaluation. Blank are clinical judgments of a patient's actual or potential health problem that is within the nurse's scope of practice to address. Nursing diagnosis. How many patients die annually in hospitals due to medication errors? Up to 98,000. BCMA, or Barcode Assisted Medication Administration. It's technology used to verify and document medication administration at the point of care, which is usually at the patient's bedside. Blank is what links interventions to establish outcomes. That's planning. A nurse is taking a patient's vital signs, checking incision site, and determining if he is in pain. What step of the nursing process is she using? And that's assessment. During what stage of the nursing process do you discuss meds and their side effects? And remember, patient education is key, and that's the book said implementing, but I'm assuming that's also the intervention stage. A patient is complaining of pain in his incision site. The nurse is administering morphine sulfate. What step of nursing process is she using? And that's intervention. Patient teaching regarding CAM. Pregnant women should only take prenatals and advise caution with serious allergies. Stick to the recommended dose on the label. Take the smallest amount at first to see if you have any allergies or adverse effects. The impacts of medication errors include an increase in the length of patient stay, legal costs, damage to the hospital's reputation, and preventable death. Medication reconciliation means tracking the meds, especially at discharge. Have your patient teach back the medication instructions that you're giving them, and encourage the patient to use one pharmacy for all of their medications. Cultural and ethnic influences on pharmacotherapy. The ethnicity is the biological and genetic similarities. Culture is like your rituals, religious beliefs, language, special diets. Be aware of alternative therapies, and that's like using herbalists or spices or like the medicine doctors in the Native American culture. The role of the nurse in emergency preparedness: know your disaster plans, know your resources, know your early signs and symptoms of bio and chemical agents, be involved in developing emergency management plans. Emergency preparedness: know standard contact and droplet precautions. And the CDC puts biological threats categorized by potential impact. And let me see, I have that. Okay, so your categories of infection agents are A, B, and C. A is a cause of high mortality and easy transmission. That's like your anthrax, botulism, smallpox. B is a moderately easy to moderately low morbidity. That's like E. coli or viral encephalitis. And C is like an emerging pathogen that could be used. And that's like the hantavirus, tuberculosis, yellow fever. The concept of holistic pharmacotherapy is to recognize the patient as more than just their disease, take into account their body, their mind, and their spirit. The 5 phases of the nursing process are assessing, diagnosing, planning, implementing, and evaluating, or ADPI. Environmental factors that influence pharmacotherapy could be where a patient lives, the population, if they're technology rich or poor, their literacy and education levels, and their access to care. The 5 variables that can affect individual variation in response to pharmacotherapy is their psychosocial variables, cultural influences, environmental influences, genetics, and gender.